Hi, everyone. Welcome to the Toddcast, bringing you unbiased, student-created, politics-based broadcasting, made possible by the Schar School of Policy and Government. On this week's episode, we're going to be talking about COVID-19 and where we stand 8 months into the pandemic, and what the future could possibly look like as we head towards the new year. Today, we are also bringing you a special guest. Yami is joining us. She's a member of the Schar School Policy and Government Student Organization, and she's going to be helping us go through this topic today.
Yeah, and first we're going to discuss what is the current situation. So the Trump administration's coronavirus response coordinator, appearing at the White House with other top federal health officials for the first time in months, issued a dire assessment of the pandemic on Thursday, November 19th, along with an urgent warning for Americans to increase their vigilance as they await approval of a vaccine. The United States passed 11 million total coronavirus cases on November 15th, and its caseload has now soared past 12 million. New daily cases are approaching 200,000. On the 20th, the country recorded more than 198,500, which is a record. As the nation reconsiders the usual winter holiday travel and cozy indoor gatherings, new cases are being reported at an unrelenting clip. The 7-day average has exceeded 100,000 cases a day, every day for the last 2 weeks, according to the New York Times database. The latest virus surge began accelerating across the country in mid-October. It took just over 2 weeks for the nation to go from 8 million cases to 9 million on October 30th. Going from 9 to 10 million took only 10 days. From 10 million to 11 million took just under 7 days.
Now we're going to be talking about what this means. The rising numbers have brought some hospital systems to their knees and prompted state leaders to take action to help curb the spread. At least 24 hospital leaders warned the American Hospital Association they are experiencing staffing shortages. Nancy Foster, the association's vice president for quality and patient safety policy, said those concerns have been raised in states including Texas, Wisconsin, Illinois, Minnesota, and North and South Dakota, all of which have recently seen infections climbing. She's added. And those shortages are hard to fix when pulling from a workforce of healthcare employees, quote unquote, justifiably experiencing a significant emotional and physical toll due to the impact of the pandemic, Foster said in a statement to CNN. In rural areas of the country, the challenges are even greater. Of about 2,000 hospitals considered to be rural, about 1,700 have 50 beds or fewer, and about 1,300 of them have 25 beds or fewer, according to Tim Morris, Associate Administrator for Rural Health Policy in the federal government's Health Resources and Service Administration. We're not talking about large facilities. We're not talking about a lot of ICU capacity, Morris said during the National Institute of Health Rural Health Seminar. And a lot of these hospitals were able to offer an ICU of 1 or 2 beds. Responding to the crisis, multiple governors this week announced new measures to combat the surging infections and relieve strained hospital systems.
All right, and now for some good news, we're going to talk about vaccine. So on Friday, Pfizer and BioNTech submitted an application to the United States Food Drug Administration for emergency use authorization for their COVID-19 vaccine candidate. The vaccine, known as BNT162b2, could potentially be available for use in high-risk populations in the United States by the middle to the end of December. Pfizer and BioNTech said in a statement earlier Friday, the vaccine requires 2 doses a few weeks apart and protection is achieved 28 days after the first shot. The submission to the FDA is based on results from the phase 3 clinical trial of Pfizer's vaccine, which began in the United States on July 27th and enrolled more than 43,000 volunteers. The final analysis from the trial found the coronavirus vaccine was 95% effective in preventing infections, even in older adults, and caused no serious safety concerns, Pfizer and BioNTech said this week. The submission also includes safety data on about 100 children ages from 12 to 15. Pfizer's application for EUA is encouraging, but the Infectious Disease Society of America stressed in a statement on Friday that a transparent review of Pfizer's data is still needed. While encouraging data from Pfizer and BioNTech, COVID-19 vaccine trial indicate the welcome possibility of a critical new tool against the pandemic, a comprehensive, transparent review of data. including evidence that the vaccine has been studied in diverse populations, remains essential to ensure its safety, effectiveness, and acceptance, Dr. Barbara Alexander, president of IDSA, said in a statement. If emergency use authorization is granted, clinical trials and data collection must continue. Measures that include wearing masks, frequent hand washing, maintaining physical distance, and restricting the size of gatherings will remain crucial, the statement said in part. Finally, new federal funding must be provided for widespread, fair, and equitable vaccine distribution in addition to campaigns to build vaccine confidence.
So now that there's a potential new vaccine on the market, we're going to be talking about the next steps that could happen. Moderna, another pharmaceutical company, announced Monday that early clinical trial results show its vaccine is 94.5% effective, and it also plans to apply to the FDA for authorization after it accumulates more safety data later this month. It will make sense that in all likelihood, the FDA will consider both applications together, considering that both the Pfizer and Moderna vaccines use the same technology and appear to have very similar safety and efficiency results from their large-scale clinical trials. The FDA has been preparing the review of EUAs for COVID-19 vaccines for several months and stands ready to do so as soon as an EUA request is submitted, FDA Commissioner Dr. Stefan Hahn said in a statement Friday. While we cannot predict how long the FDA's review will take, the FDA will review the request as expeditiously as possible while still doing so in a thorough and science-based manner so that we can help make available a vaccine that the American people deserve as soon as possible. If the FDA authorizes the vaccines, they can then be immediately distributed to states according to the presentation made last month at the U.S. Centers for Disease Control and Prevention. However, no one can be vaccinated until a CDC advisory committee reviews the data, recommends a vaccine, and decides which group will receive it first. After authorization, the CDC's Advisory Committee on Immunization Practices, or the ACIP, an independent panel of experts, will meet within 24 to 48 hours, according to a CDC spokesperson. At that meeting, the committee will determine if everyone should get the vaccine or if some people should be excluded. We have all been alerted on ACIP. We should be very flexible with our calendars because it's likely there won't be a lot of advance notice given for this meeting. It will be done very, very quickly, Dr. William Schaffner, a committee member, told CNN this week. Once ACIP issues its recommendations, vaccinations can be given. We have a plan in place that the moment the FDA concludes that the vaccine is safe and effective, we have a system in place to begin, within 24 hours, shipping that vaccine to hospitals, healthcare facilities, and 24 hours after that, literally injecting that vaccine into Americans, Vice President Mike Pence said during a White House Coronavirus Task Force briefing on Thursday. States are currently working out the details of running vaccination clinics. The Pfizer vaccine is particularly complicated since it must be stored at minus 75 degrees Celsius, and doctors' offices and pharmacies typically do not have freezers that go that low. The first groups expected to receive the vaccine are healthcare workers, the elderly, essential workers, such as police officers, and those with underlying medical conditions.
Now with the holidays coming up, especially Thanksgiving, it's important to talk about how we can celebrate the holidays safely and prevent us from getting coronavirus and or spreading it to our loved ones. So first, guests should be aware of all these considerations and ask their hosts what mitigation measures will be in place during the gathering. Hosts should consider the following. First, check the COVID-19 infection rates in areas where attendees live on state, local, territorial, or tribal health department websites. Based on the current status of the pandemic, consider if it's safe to even hold or attend the gathering on the proposed date. Second, limit the number of attendees as much as possible to allow people from different households to remain at least 6 feet apart at all times. Guests should avoid direct contact, including handshakes or hugs, even with others, especially from others not in that same household. Third, host outdoor rather than indoor gatherings as much as possible. Even outdoors require guests to wear masks when not eating or drinking. Also, encourage guests to avoid singing or shouting, especially indoors. Keep music levels down so people don't have to shout or speak loudly to be heard. Encourage attendees to wash their hands often with soap and water for at least 20 seconds. If soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Provide guests information about any COVID-19 safety guidelines and steps that will be in place at the gathering to prevent the spread of the virus. We also have to keep in mind that there are some states that have changed their regulations, California and Oregon just changed their regulations as well. So especially if you're traveling out of state or you have guests coming in from out of state, always make sure that you are giving them the current precautions. You want to limit contact with commonly touched surfaces or shared items such as serving utensils. Clean and disinfect commonly touched surfaces with any shared items between when feasible. Use EPA-approved disinfectants. Use touchless garbage cans if available. Use gloves when removing garbage bags or handling and disposing of trash. Wash your hands after removing your gloves. Plan ahead and ask guests to avoid contact with people outside their household for 14 days before the gathering. Also remember to treat pets as you would other human family members. Do not let pets interact with people outside the household. Encourage guests to bring food and drinks for themselves and for members of their own household only. Avoid potluck-style gatherings. Wear a mask when preparing the food or serving the food to others who don't live in your household. All attendees should plan for where to store their masks while eating and drinking. Keep it in a dry, breathable bag, like a paper or mesh fabric bag, to keep it clean between uses. Limit people going in and out of the areas where food is being prepared or handled, such as the kitchen or around the grill if possible. Have one person who is wearing a mask serve all the food so that multiple people are not handling or serving the utensils. Use single-use options or identify one person to serve shareable items like salad dressings or food containers and plates and utensils and condiments. You want to avoid these higher risk activities to prevent the spread of the virus, like going shopping in crowded stores just before or on Thanksgiving, like for Black Friday, participating or being a spectator at a crowded place, parades, large indoor gatherings with people outside of your household, or using alcohol or drugs that can alter your judgment and make it more difficult to comply with the COVID-19 safety measures. Instead, we want to try some of these lower risk activities, such as having small dinners with only the people who live in your household, preparing traditional family recipes for your family neighbors, especially those with higher risk or severe illnesses from COVID-19, and delivering them in a way that doesn't involve contact with them. Or you could also try having a virtual dinner and sharing recipes with families and friends, shopping online rather than shopping in person, or on the next day of Thanksgiving or the next Monday or on Cyber Monday, and watch your sports events and parades and movies from home. These are all ways that you can help mitigate the risk and still enjoy and celebrate Thanksgiving. Of course, this year is going to be different than all the other years, but if we just can hold out and make sure that we're all keeping each other safe, hopefully by next Thanksgiving or even by Christmas, we can start to celebrate more with family and we don't have to do this anymore. But it's very important that for the time being, we follow these rules, and I know it's going to be hard, but we have to do this so that we can help protect our loved ones.
Yeah, and one thing that just to quickly note about our information about COVID-19, we did all this research on the week of November 16th, so all these numbers are continuously changing and not in a good way. So really take that into account. I know Thanksgiving is tomorrow, so please just be thankful, thinking of everyone around you as you're thankful for everything that you have right now.
Also, to add on to that, Mariam already mentioned to keep up to date with state, local guidelines. Also, the CDC website is a good source to look up information as well.
Yes, ultimately, this virus has changed a lot of how we live our day-to-day lives. And for a lot of us, it's been really difficult because we either have family members who are out of town and we're used to visiting them, or even our grandparents who live close by, but we haven't been able to see them. And it's gone from cases where people have been, hospitalized by themselves, or, grandkids are being born and they're not able to even meet their grandparents for the first time because of this pandemic. There's a lot that's on the line here, and it's very difficult, but we need to remember to try and not just be thankful for the people we have, but to have a little bit of empathy and be just a little bit more selfless this holiday season, because as much as we want to enjoy and have fun, it's important to keep in mind how our actions affect other people, and how sometimes if we're willing to take a risk doesn't mean that everybody else around us has consented to taking that risk with us, and to make sure that whatever we're doing, we're not putting the people that we love at risk.
Yeah, this is a really hard time for everyone, especially as we go into the holiday seasons. I think isolation's really coming back and hitting everyone in a second wave. And I think that a lot of the coping mechanisms that people had in the beginning of the pandemic, like Zoom happy hours and like meeting people over FaceTime and just continuously keeping in touch, I feel like we've kind of become desensitized to this whole pandemic since it's been so many months. But I think kind of going back to the things that kept us all sane in the beginning are really what we're going to have to lean into now as we get into a time when we would normally be surrounded by people. It's like rough for everyone, but just remembering that there are things that we can be doing to stay connected, and just leaning on those things at this time.
We've seen the idea of a proposed lockdown, like a second lockdown like we had in the beginning of the pandemic. Yami, what do you think about that? Are you more with the fact that we should just keep going with what we're doing now and hope for the best? Or should we try to issue some of these lockdowns that are stricter even than before, like countries like Australia or like Canada, and hope that we go on the same trajectory where now they don't have any new cases at all?
I definitely think there should be a lockdown, but that being said, if we do have a lockdown, we need to provide financial relief to communities that don't have enough savings to sustain themselves during a long-term lockdown. And I think with the lockdown, there has to be that, like what we had in the beginning, that stimulus check, or even the additional $600 when you got your unemployment check. I think those measures need to be in place as well. Those have to go hand in hand, because we can't just impose a lockdown and have people, especially in minority or poor communities where it's mostly affected, where they're mostly affected by the virus, and they don't have any financial support from the government. And then now they're most likely probably out of a home at that point. And once they're out of their home, they're more susceptible to being infected by the virus. So I think there should be a lockdown, but also the government should provide financial relief for people.
Yeah, I think you bring up a really good point about financial aid given during this time, and we actually did an episode on when we could get another stimulus check a few months ago, so you should definitely check that out if you haven't already. But Yami, do you think that we're going to have to, do you think that because of the recent surge in cases that the government will feel more inclined to speed up the processes in passing a bill on a stimulus check, or do you think we're going to have to wait for the next administration to come in for that to happen?
I honestly think we're probably going to have to wait until the next administration for a lockdown to happen, because right now, who's controlling the bill is Congress. And so the House and Senate, especially when the Senate is controlled by Republicans and the House is controlled by Democrats, there's going to be some tension and not agreeing on things. And I know right now the Democrats aren't willing to sign on the bill, especially if they provide financial support to corporations who don't have, who aren't implementing like CDC guidelines on COVID-19. And like, that's one of the main things why we haven't seen a resolution on it, because Democrats are against it because of that particular proposition in that bill. And then Republicans aren't trying to concede that proposition. So they're still fighting in Congress. And I believe right now they're even on a recess, like they're on a holiday right now. So we probably won't see anything until after the holidays, so next year, or the new administration. And right now we're seeing that states are handling this. I think California, like Mariam said earlier, I think Imani said that California and Oregon, they changed their guidelines, and it's having large gatherings and going out and all this stuff is being more restricted, whereas we see Texas, the governor isn't doing anything. He's just leaving it as it is. So I think right now we're kind of in a limbo, and I definitely think we'll just have to wait until the next administration. But I see states are trying, or at least some states are trying to implement some sort of restrictive measures.
Yeah, and one of the interesting things that you brought up earlier was the stimulus checks. And one of the most interesting things I've seen online is that in the United States, most citizens got $1,200, and that was supposed to have lasted them for 8 months. And that doesn't even cover some people's rent for 1 month. That's like half. And while other countries have gotten double what we've gotten per month since the pandemic has started. And so there's definitely a big difference in how our country is dealing with this and how other countries are dealing with it. And sort of this leaving it to each state has caused more issues than I think people have thought about in the past, because now, especially with the holidays, people are traveling. So while you maybe live in a state where you have very strict guidelines and everyone is obeying the rules and your numbers are going down, now that the holidays are just around the corner, people are flying in from states where that's not being implemented at all. And so you're bringing in more of this virus from people who just are not required to follow the same rules that you're following. And so that's something that I think the government should have considered, especially this close. And we're now at the end of the year. It's been a year since coronavirus was first discovered, and we're not anywhere closer to figuring out how to solve this than when we were a year ago. And so hopefully, I mean, we can all just keep our fingers crossed that when the vaccine comes out, that A, it's going to be widely available to the public, B, it's going to be affordable for people, because we also have to figure out that since a lot of people lost their jobs due to the pandemic, a lot of people don't have health coverage anymore. And so they might not even be able to afford it because of insurance. So that's another thing we have to consider as to how we're eventually going to get out of this.
Yeah, I think a lot of emphasis at least in the last couple of months, was put in the new year and how the new year is going to bring about all this change, and how 2020 is going to be our saving year after this year. But I think because of how assorted the different states' legislations have been on COVID, it's just been really hard for there to be a unanimous kind of push in the United States to lower numbers and lower the curve. And that's kind of why we're seeing this surge right now. The vaccines that are coming out bring a lot of hope, for sure, but even then it'll be late spring, summertime to when things start looking a little better, if the vaccines are able to get out to people in enough time. And so there's still so many months that are still kind of gray areas in terms of what could happen and what everything is going to look like. And it really and truly is probably going to look more so of what we've been going through now. And so I think what really needs to happen is more of a unification of legislation, because the hodgepodge of different states being mask mandate, no mask mandate, do this but don't do that, it's really hard in terms of trying to lower the numbers that the United States has, especially if you look at how other countries have handled the decisions in response to the COVID-19, and how they have unified the country in a single or a few different mandates, and that's helped them bring their numbers down. And even if they've had to go into lockdown 2.0 like Canada per se, they're still doing it as a unified force, which kind of puts everyone on the same page, making it easier for them to manage the cases that they're having.
Yeah, I definitely agree with Mariam and Imani, especially on just going back to the stimulus check, where it's not enough. It really isn't. It was supposed to cover, like Mariam said, 8 months of lockdown, or not lockdown, but 8 months for people to be supported by it. And it literally, it went away. And I honestly think in that month we got it, and some people didn't even get it for whatever reason. And that's still an issue that needs to be discussed. And like Imani said, there's a lot more into it that needs to happen, a lot more unification on passing another relief bill on it. And I think with President Trump, what he did is that he let the states decide on what to do. In the beginning, that was kind of fine because you saw some states who didn't have that much cases. But now that, because of the holidays, like you guys were saying, a lot of people are going to different states and potentially putting other people in those states in high-risk situations of being infected by the virus if they have the virus. And I think it needs to be more of the federal government needs to deal with this and create a national lockdown with an appropriate amount of financial aid to every person in the United States. And I think that's one of the things that needs to happen. And I know Republicans don't like this approach because of the federal government becoming too involved. And but in this case, the pandemic has caused so many lives in the United States. I believe we're over 250,000 deaths, and in just 8 months. Like, imagine if, like Imani was saying, we won't get the vaccine probably until late spring, early summer, and the cases will just keep on rising and rising if nothing is done. And yeah, I just think that right now, with the guidelines that Mariam provided, is the safest way to go on about it, especially during the holidays, because that's when a lot of people want to gather and be around their friends and family. But this year we just can't. And honestly, the best way to be in touch with people that we love, like Imani said earlier, doing like the Zoom happy hour stuff, or like just calling each other, or FaceTiming, or even going like on a short little walk in front of your house, like, you know, get some fresh air with like obviously a mask on. But yeah, there just needs to be a way that the United States government needs to find a way to unify both sides to create a possible reduction on the cases that are rising.
Yeah, and to your point, Yami, I'm not saying that there's a causation there, but there's definitely a correlation between red states and the states where the numbers are still continuing to rise. And that's something to note as well. Obviously, we can't take sides here, and we're not telling you, you know, one way or another, but that's just a point of interest, and I'm sure I'll leave more information about that in the comments down below. But yeah, overall, like Imani and Yami said, we need to just make sure that what we can do as citizens is try to protect ourselves and our families to the best of our abilities. And even though the holidays are coming up, we still need to do that. The coronavirus isn't going to go away after Thanksgiving. It's not going to go away after Christmas, and it's definitely not just going to disappear in 2021. So we just need to continue to do our best. Thank you guys so much for listening. This has been one of our most important episodes so far, just because we are just as affected by this as everybody else, and we want to make sure that, since Thanksgiving is tomorrow, as of the day of uploading this episode, we want to make sure to do our best to spread as much information about this as possible. And of course, as always, all of the information that we have given you guys in this episode will be linked in the description down below. It's been awesome having Yami here today as our first guest to talk about this very important topic. And we're going to link also last week's episode in the description and the end of this video. And yeah, we appreciate you guys so much for listening. We hope you have a happy Thanksgiving, and we'll hopefully see you guys next week.
Bye.
Bye. Thank you for having me.